My name is Dr. Prabhakaran. I am a practicing gastroenterologist. Today I am going to talk to you about hepatitis. What is hepatitis? Hepatitis, the meaning of the word is inflammation or swelling of the liver. When inflammation or swelling happens when there is a injury to the liver, this injury can be due to various causes like drugs, toxins, infection by various viruses, virus also. And of this, the commonest cause of hepatitis, commonest cause is viruses. There are different types of viruses causing hepatitis. When the cause is virus, it is called viral hepatitis. Mainly 5 different types of viruses have been identified causing hepatitis. These viruses are named as A, B, C, D, and E. Of this, A and E are very common and they are spread through contaminated food and water. B, C, D are very serious forms of cause very serious forms of hepatitis and liver disease. Hepatitis A, as I told you, is commonly transmitted through food and water. B, C, D are mainly transmitted when there is the patient comes in contact with the blood of infected patients, or when it is also seen in intravenous drug users where they share the needles, syringes, razors, toothbrush, etc. And patients who are operated using unclean instruments also get these forms of disease. And this is a very rare thing and is not at all important. In India, hepatitis B is seen around 3% of the people, whereas C is seen in less than 1% of the people. And one of the important causes of hepatitis is alcohol. Alcohol, when we drink in large amounts, it causes liver damage, and this is called alcoholic hepatitis. And alcohol hepatitis can occur in 1/3, nearly 30% of the people who drink large amounts of alcohol. Alcohol hepatitis, as I told you, it is only seen in 1/3 of the people. So there are certain risk factors for developing hepatitis. These risk factors are females who drink alcohol can there is a high chance of developing liver disease or alcoholic liver disease, and people who are very obese, overweight people who take alcohol can also develop hepatitis, and black people have got a more chance of hepatitis. And it is something called binge drinking. Men who take 5 drinks in 2 hours, 5 or more drinks in 2 hours has a more chance of developing hepatitis. Females, if they take more than 4 drinks in 2 hours, this is called binge drinking. And these alcohol patients usually they don't eat well, and so even though they don't take proper or nutritious food, and this state is called malnutrition. This also contribute to the development of liver disease. And how do we recognize viral hepatitis? Sometimes the disease can be totally asymptomatic and patient don't have any symptoms at all, and the condition is diagnosed when they come to the doctor for some other problem. But symptoms of hepatitis are usually like a viral fever. They got fever, headache, myalgia, nausea, vomiting, and some people also have got abdominal pain, and some people say that they have got change the color of the urine, and some people also notice that their eyes has become yellow. So these are the ways in which the hepatitis presents. How do we diagnose hepatitis? There are various ways in the disease can be suspected and diagnosed. When you suspect viral hepatitis, you have to take a detailed history, like any history of travel abroad, history of taking drugs, history of taking alcohol, so any surgical procedures, blood transfusion. All these points are important in arriving at a diagnosis. And to confirm the diagnosis, various blood tests are required. Various blood tests called liver function tests are usually done, and these tests various parameters like bilirubin and liver SGU, ALT, AST tests are used. And in hepatitis, bilirubin, ALT and AST are very highly raised, and this is almost confirms the diagnosis of viral hepatitis. And to find out the cause of viral hepatitis, we have got a blood test like viruses like virus A, B, C, D and E can be diagnosed by using the various blood tests. Sometimes additional tests like ultrasound scan, CT or MRI may be required. Liver biopsy was formerly used but rarely done nowadays to make a diagnosis of viral hepatitis. And how to treat, when you suspect and you make a diagnosis of viral hepatitis, how to treat it. And hepatitis A and E are causes acute hepatitis and usually requires mild and symptomatic treatment. Whereas diseases caused by B, C, D are chronic, and they causes chronic forms of liver disease like chronic hepatitis, cirrhosis, and it is complication liver failure and hepatocellular carcinoma. For B and C, various novel antiviral treatments are available, and these drugs will have to be given for a long period of time. And what about alcoholic hepatitis? Most important thing is to advise a patient to stop drinking, and along that various supportive measures to help the liver to recover the damage and to prevent further damage will have to be taken. And usually these people are malnourished, and good food, nutritious food also has to be advised. And various specific treatments also are available for viral hepatitis. Complications in chronic hepatitis, a lot of complications are available like chronic liver disease, and they go for cirrhosis, liver failure, liver cancer, and how to prevent viral hepatitis. Now it is easy to prevent viral hepatitis. For example, for hepatitis A and B vaccines are available, and now this vaccine can be given soon after birth, and this can prevent the development of hepatitis. There is no vaccine for other forms of hepatitis like B. C there is no vaccine. D and E there is no vaccines available, and B and C can be mainly prevented by using various precautions like not sharing the needles, razors, toothbrush, etc., and not going to the habit of intravenous drug use. And alcohol hepatitis, the main thing is use alcohol in moderation or stop drinking, and maintain nutritious diet and healthy body weight and regular exercise. This can help to prevent damage due to viral hepatitis. And how can we keep the liver healthy? Healthy liver is essential for a healthy life. So it is important to maintain the health of the liver if you want to have a happy and a healthy life. And the important things are, one is for, as I told you, for hepatitis A and B vaccines are available. Use vaccines, and this can prevent the development of viral hepatitis. Use alcohol in moderation. Drink for social drinking. Use small amounts of alcohol. Binge drinking and continued use of large amounts of alcohol can produce serious form of liver injury. Sometimes this may not. This can progress to various complications also. And eating a nutritious and balanced diet is also important. Regularly exercise. When you exercise, it helps to reduce the fat accumulate the liver, and this condition called fatty liver can also be prevented. And various toxins and over-the-counter medications can be stopped when you suspect various forms of liver disease. And this is something about viral hepatitis. I thought it will be beneficial to those who see this video. Thank you.